it's always worth having a look at the documents on the portal, having a look through, and there are some really useful things. There are clinic letters, there are, for us, there are pre-operation notes, there are discharge summaries, and they can provide really useful information about why a patient's on a particular drug, whether they really did have a heart attack last week or whether it was just non-specific chest pain, and the specifics of what operation they actually had or what operation was actually planned is really, really useful. And it's much quicker than trying to work out who you need to ring and then ringing and leaving a message and then getting them to ring you back. So that is really speeds up our MDT.